So our next session features a product demo by Micheal Faladae, the Chief Technology Officer at Afrihealth. Micheal is a seasoned software engineer with experience in banking, fintech, and healthtech. He is currently building Afrihealth, a healthcare provider company in Nigeria with a mission to deliver quality domestic, local, and international healthcare solutions and medical services to its beneficiaries. Afrihealth provides services including health insurance plans, health risk assessment, occupational health management, and employee well-being services, which emphasize their focus on preventative care and wellness. They also have a global network of over 5,000 health providers spread across Africa, Europe, Asia, and the US. Please join me in welcoming Micheal Faladae to give the product demo. Welcome, Micheal.
Thank you. It is indeed my pleasure to be here today to talk about Afrihealth. As a software engineer, I've always wanted to do something that positively impacts humanity. We know that in Nigeria, a lot of medical professionals they travel out of Nigeria to seek greener pastures, and so that has created a vacuum in the system. So Afrihealth, it is out of that need to, connect medical professionals, medical doctors, nurses, pharmacists to patients. That is why we do the work we do at Afrihealth, and I'll be glad to take you through the journey. So Afrihealth basically, Afrihealth is being headed by a fantastic woman, an amazing woman. That is Linda Obi. She's our CTO, and Jude Chikize is another thought leader in the health tech space. He's our head of partnerships, and we have Sulaiman Alegbeleye, who is our chief operating officer and chief technology officer. So the slides, and thanks for the So can you project the slide, or am I supposed to do that from here?
Hello, Michael, if you can.
I'm going to project the slides in a minute. In just give me a few seconds. Okay, and okay, thank you. Okay. I'm just going to share my screen now. Can you see my screen now? Okay. So harnessing technology to transform patients' outcomes in Nigeria. So like I mentioned earlier, Afrihealth is an health tech company, and in responding to the needs I highlighted earlier, we've built two platforms. The first one is Rigor Plus, and we also have Hydra as well. Rigor Plus is our B2C platform. Rigor Plus allows users to do medical consultation with medical doctors on our platform. We have about 5,000 medical doctors on our platform. They have diverse areas of specialization, and also on Afrihealth, after patients take their medication, they are also able to purchase medication on the same app. Then we also have the emergency response system within Rigor Plus. So people can request for ambulance services on our platform. So basically, again, over 60% of Nigerians live in rural areas limited with limited healthcare facilities. Also, workforce deficits. Nigeria has less than one doctor per 5,000 patients, far below the World Health Organization recommendation. Affordability issue. Nigerians struggle to afford quality healthcare due to high out-of-pocket expenses. Now, the role of telemedicine. The role of technology in healthcare transformation. Telemedicine and healthcare services, access to healthcare in rural areas. So we all know that accessing medical care in rural area in Nigeria can be a bit challenging. I remember when I was serving in Ibadan, we traveled to this village then. We drove about 6 hours to this particular village in Oyo State, and so we went with that was part of Nigerian Christian Copper Fellowship then, and we went to this village. These people have no hospitals. Our doctors. We went with doctors and nurses that attended to a lot of people, and that was when I appreciated the deficit of healthcare professionals and medical services in the rural area. So there's a way Afrihealth addresses this. We have this mobile health platform aside from our mobile app that facilitates medical consultation. We have this mobile health clinics. Right now we're in partnership with Lagos State's Ministry of Health, a particular district of the Lagos State Ministry of Health, where we've been able to set up primary health clinics in about 4 locations. We're starting with 4 locations, and the adoption is quite encouraging. A lot of it's through our mobile health clinics. Our doctors are able to do virtual consultation for a lot of people in these primary health clinics, and they also prescribe medication as well to those people, and cases that require hospitalization are being addressed. So I've talked about mobile health application. So we have a telemedicine platform that is Rigor Plus. So aside from consultations by purchase of medication and emergency response services, we also give health tips from time to time to users of Rigor Plus. Now, so electronic health record system. So Afrihealth, we also, like I mentioned earlier, we have this Hydra. Hydra is our B2B platform. Is an electronic health record system or electronic medical record system that we deploy to hospitals. Right now, over 20 hospitals across Nigeria, West Africa, and I think we're also onboarding an hospital, in the United Arab Emirates. So we have over 20 hospitals using our electronic health, record system here. Our electronic health record system facilitates virtual consultation, IVF management, and AI guided, AI enabled diagnostics. So Hydra is highly recommended for hospitals. Now, like I mentioned, so Afrihealth, we are leveraging AI and other emerging technologies, to transform patients' outcomes, in Afrihealth. Like I mentioned earlier, on Hydra, we've been able to, integrate AI platform that can assist doctors in diagnostics. You can take, for instance, pictures of a skin. You can take pictures of your skin. Maybe there's an abnormality on your skin. You can take a picture. Or our doctors can upload it on Hydra, and Hydra can help with diagnostics. Then I've talked about mobile health clinics and diagnostic tools. Okay, so now our mobile health clinics, aside from the consultation, the virtual consultation platform, we also have diagnostic tools as well that are integrated into our systems. For instance, we have this is a urine analyzer, for instance. It's integrated into our systems. So with this, we can make, diagnosis. It's incorporated into our systems, and it helps us, serve, patients, in effective ways. Then blockchain-driven traceability technology. So another product that we have developed in Afrihealth, it is called PyCon. This is our track and trace. This is our blockchain powered traceability platform. So on Afrihealth, we are one of the licensed traceability vendors in Nigeria. We're licensed by GS1. GS1 is a standardization body for track and trace, and GS1 is working with NAFDAC, in curbing this menace of counterfeit drugs. So Afrihealth is one of the partners of GS1. We are licensed by GS1 to deploy our track and trace solutions to pharmaceutical companies, and even aside pharmaceutical companies, even FMCGs are also able to use our traceability platform to track end-to-end logistics, to manage the end-to-end logistics, of their supply chain. Yeah. So through GS1, like I mentioned, it's one of the government and private sector collaboration through GS1. We are part of that drive to ensure that every drug that is being shipped or into Nigeria, that is being manufactured in Nigeria, are adequately tracked, and they can be traced. Then support for health startups. So for instance, we have a platform. We've been able to build a I will call it consultation on demand platform that other health tech startups can leverage on. Right now, we have about 3 of such companies that are presently doing integration with us. Aside that, we also have notable health insurance providers that are also collaborating with us. For instance, before we're not able to do hospitalizations, because we're not an health insurance, provider. So, but with our, collaboration with NEPS Insurance now, patients that require hospitalization can be referred to hospitals through, thanks to our partnership with NEMS. Also, we are also able to sell NEMS plans on our platform as well. Now, features of Regal Plus, the virtual consultation, the medication verification, integrated ambulance services, the smart clinic and telemedicine booths. I've touched on this. The impact on patients, enhanced accessibility. Regal Plus, rural patient gain access to, with Regal Plus, rural patient gain access to specialist care without traveling long distances, improve efficiency, digitalize patient records, streamline care delivery, reducing medical errors. Then health education, users receive guidance on preventive health practices. We have a large community where healthcare professionals people can interact with healthcare professionals. For instance, we have this group for new moms and pregnant women. On this community, pregnant women or new moms can ask questions, and they receive response from our from doctors on our platform. The ones that require consultation, they are being referred for consultation. And so Afrihealth is a big health tech ecosystem, and we keep improving to deliver quality and affordable services to our users. So these are pictures from our smart clinic consultation, or there's some specific. Okay, so these are pictures. Also, we do outreaches as well. We're also in partnership with Enugu state government. Allows our secretariat, with Lagos state government. We've done a lot of outreaches. So now, lessons and future opportunities. Regal Plus demonstrates that technology can address systemic healthcare issues in Nigeria. However, scaling its impact requires strategic partnership, collaboration with HMOs and hospitals to integrate health services nationwide. We're already doing this, like I mentioned. Increased investment, of course. We are really looking to scale in certain areas. We want to do R&D in certain areas, and so we need support and investments. Also, purchasing this peripherals for our telemedicine platform requires a lot of money. So we seek government support in this area, and also investment from the private sector. We are making a lot of impact. We are bringing affordable healthcare to the underserved people, to the less privileged people. Support is highly welcome. So, I mean, that'll be all for now, and I'll be taking questions.
That was an incredible presentation. You see all the innovation that you're working on. We do have one question in the chat, so and we have a bit of time to answer it. So Raphael is asking, as to requesting for EMS, how do you deal with areas whereby there is no telecommunication networks?
Okay. Thank you. So, for instance, now I mentioned mobile health clinics. So right now we have 4 locations. So we make use of primary health clinics. We're in partnership with the Lagos State government. You know, we've done a pilot. I projected pictures from there. So we find a network that works, and with that, we're able to connect this people to our doctors. Also, we also go there with our diagnostic devices as well. And cases that require hospitalization, we can facilitate such. Is there any other question?
No, that's the only question. Okay, I thought you were still speaking. Thank you. I believe you've answered this question properly. That was a very insightful demonstration, and we got to see a little bit of how your technology works in action and how it's driving real change in healthcare. So thank you very much, Micheal, for the product demo.
You're welcome. Thank you.
Thank you. And thank you to everyone that has stayed with us this far. Thank you to our sponsors, partners, and speakers. We're incredibly grateful for your support. We'd also like to thank the Lagos State Health Management Agency, the Lagos State Ministry of Health, the Ministry of Health of Zambia, the Mandate Secretariat for Health and Environment, the Federal Capital Authority Abuja, the National Agency for Food and Drug Administration and Control, NAFDAC, and the Lagos State government for their support. So thank you very much, everyone. It's been an incredible session so far. Now, on to our final panel session for today, which should be in health data governance and privacy, the challenges and opportunities of artificial intelligence. This topic is very important. It's very timely with the rise of AI and health data breaches. So the session is now live. To join the session, go to the agenda at the top of the conference platform. Simply click the join button on the right of the next session's topic and you're in. See you in the next session.